Yep, we're recording. Okay, thank you
Yep.
very much.
Okay, cool.
Thanks, Pam.
All right, so let's kick off. Great to see everybody, and just to talk about kind of the sort of goals for today. I think we're working on our mission a little bit, and talking about priorities as a pretty useful tool that we can use to fulfill our mission of providing oversight to the health department and the Human Services group, and also come up with recommendations as appropriate for both the commissions and the first select person. And I think we've talked a bunch about one of our jobs being coming up with priorities. And one of the things I wanted to cover off today was to propose sort of a framework for priorities, which will be a little bit different, and I think lends itself to recommendations. And then hopefully, once we kind of go through that and see if people are comfortable with it, we can begin the process of populating that framework, and then realistically, work will probably continue over the next couple of months. And the end goal is to have something ready for the full commission to vote on, and then pass up to a leadership. So, does that make sense for everybody? So the framework that we're sort of thinking about is breaking the priorities into a couple different areas. First, think of it as the core, which is the essential work of the kind of health department, and the human services group. The second piece will be identifying kind of emerging issues, which we are perceiving from the market that maybe are not fully covered off in the work so far, but things that we think should be in people's minds to start thinking about and addressing. And the last bucket is in the kind of prevention upstream that we've talked about a lot, which is not really the purview of the human services group. That's something that we've talked about a fair amount. And I think that winds up a pretty interesting way to bucket the three separate things, because they're all weighted a little bit differently because the purposes are different. So, I mean, I can illustrate those a little bit, but does anybody have any thoughts or questions to what I've said so far?
Good.
Okay. Okay. Um, so, so then why don't we can start maybe marching through, and I'll sort of introduce the core kind of concept, and starting with the health department. As we all know, a lot of that work is state driven. And I think one of the things that we always need to do is ensure compliance and implementation around a lot of those things, with probably an eye toward um, uh, implementation, and where our shortfalls, staffing and things like that is kind of the core in the health area. Um, and looking at the human services side, I think the core of what they've always done has been that key safety net, so that tracking both the vulnerable populations and also the rest of the population who, when life happens, suddenly has needs. And a lot of their work is um, very much focused on people really are in trouble, having a tough time. That's when the group will be there and weighing in. And I think a lot of our work is the adequacy of the resources, and all around the interventions. And I think one of the things that we can emphasize is not just the vulnerable populations, because at any moment in time, every family needs help for sort of different reasons. And I think it's very important that we always emphasize that, because otherwise people can start to frame this as, oh gosh, frequent flyers and people who need all that. But at certain moments in time, a lot of times it's kid related, the full services are needed. Um, So that's kind of the framing how I sort of think about the core, and it's probably worth pausing there to get some feedback because there's a lot in that. But it really is the essential work they're already doing. It's very intervention focused, cases and things like that. And so I'll pause and see what you guys think about the framing of that, and then maybe we can drift into a little bit of commentaries and priorities around that area. But I wanted to check on the framing and from a definitional point of view.
That all makes sense to me.
Yeah, me as well, Peter. I think one of the things that I struggle with human services is because they have a vast, not resources, but services that they can be an entry point to for people, whether it's power, whether it's housing, whether it is, our utility cost, or whether it's insurance, whether it is, my child needs help, what services are available, how do I get them into evaluation program? I would have always liked to seen, I think Barb and I have talked about this offline, if there was a one number, a 1-800 number or something of that nature that is not for 911 calls, but for our human services department, that here is one number that we can market to the entire town, and it can be a single point of entry that whether it is Meals on Wheels, and we'll refer you to Meals on Wheels, or it is, I need to find a relief for my utility bills this month, that there is a way of communicating that. And I just think, from my own personal opinions, when you get a lot of calls, urgent calls from people as a healthcare provider, they just don't know how to navigate through the system and who to call and what specifically is out there that can assist them. So that's just
How
fun.
how does it work now? Is it not that you call human services and talk to one of those guys and they start to direct you towards who can address your needs?
That's a great point. So I don't know from the people that contact us. I think we could do a better job promoting
Mhm.
that entry point. I also know that that entry point is not, 24/7, 365,
Mhm.
right?
Yeah.
So they have a limited capacity as well. They're not taking calls. Sometimes these events happen on the weekends, as some, know, and there's just, no one there. And so often they're trying to call us, or we're trying to put them in touch with human services. So I don't want to take anything away from human service. They're doing a wonderful job. I'm just wondering if there's a better way that we can promote it, or provide the resources so it can be that single point of entry to help navigate for anyone in our town where resources may be available, or other nonprofits that they can put them in touch with.
Yeah.
That's all.
Yeah. Like a 311.
Yeah, almost for your town,
Well, and that fits into one of the big survey findings around the mental health, where awareness has really gone up a lot. People get it, people know it's an issue, but knowing what to do and who to contact is still a problem. And for me, that's something that will probably go into one of the priorities in core,
Mhm.
that where do I go? And Russ, you're kind of getting at it in sort of a different way, but I think that's sort of an ongoing challenge, and I like that a lot.
Well, Andrew Gerber, I mean, Andrew's a personal friend, as he is of Peter and many of you. He just said, I couldn't believe getting the survey results, because we've tried so hard to market this throughout the community, and for a significant portion of the community still not to know we're there, was a little disheartening for him. So how do we continue to, I guess, promote that, and so that people know when they get a parking ticket who to call, people know when it's tax related who to call. I'm not sure with the breadth of healthcare and support services they know exactly who to call. That's my only point.
Yep.
Yeah, I think obviously anything that's gonna be 24/7, 365 is gonna be hard for us to accomplish, right? And that's why things like 311 exist. Um, and so it seems to be probably more of an awareness piece, and whether it's a website rather than a phone number, just may be more tangible. There is an element I do think of engagement in town probably drives a lot of knowledge of how to access things. Whereas if you live here but aren't necessarily, find yourself kind of within the pot of environment or milieu of engagement, you're going to interact with those resources less, even if they're marketed well, right? And so, really, to me, I see it as a question of how do we reach the people who may call New Canaan their place of residence, but don't necessarily see town as like their home and family, and and that's a lot of people, and there's nothing wrong with it. I don't want to make that sound negative, but it really is that idea of and in a lot of ways, those are probably the people who need those services more. And so, how do we kind of reach those people creatively is probably where I see a bigger piece of it.
Yeah. Yeah.
I have to add one thing that I do recall when they were presenting the results, people said, okay, only 30% no, but if you don't really need any of those resources, then maybe you just aren't paying attention. And, if you do need resources, that's when that's when we want to be able to make sure they know what to do. But it's not that they're, I don't know. I'm not saying that very well. I'm just saying that there might be 20 or 30% of people who will never need the resources. So, not being aware is kind of logical.
Well,
Yeah.
I think you make a point, Barbara, and I got it is, it's how New Canaan Moms came to be, right? I think is, New Canaan Moms came to be so that moms had a resource that they could reach out to and find out about, things related to children and daycare and nannies and a whole bunch of other things. So, de facto, they created their own type of network, right?
Sure. But I agree. We should be the beginning of it, and it should be easy to be able to refer people and try and come up with good marketing and outreach to get to
To
establish.
Raquel's point, and then I'll shut up, is we have enough nonprofits, I'm just using this as an example, that if you had a call-in sheet or something and someone called you, we have enough nonprofits, I think we could fill the off hours, if you will. The nonprofits could step up and have some type of way of getting a call later at night or helping people navigate. I know we would be willing, Waveney would be willing to throw money into that pot to assist. It doesn't have to be a Waveney sponsored program, but we would be willing to help in that endeavor. But yeah.
I will say that. Oh, sorry. Go ahead.
Oh, I was just going to say, when I think this conversation has come up before, there are numbers for different things.
Right.
And so it's almost, I don't know, I keep coming back to the website idea, but like, is it a form that people click through of like, what do I need help with? And then the number actually populates so that they call the specific number they need. Just because people may not understand which branch of Health and Human Services does which thing, or because if I'm remembering from looking at the website myself, there's just lists of numbers, right? So just creating clarity could help.
Yeah, it's kind of like the Behavioral Health Commission has like 75 members now, so it's hard to know.
The Alliance, the Alliance.
Excuse me, the Alliance.
Yeah.
But I also remember Colleen Proster, she brought like a bookmark to our meeting, and it has all those numbers on it. And, but it doesn't really articulate. And I remember asking her, well, which one would you call first? And, she wasn't sure, right? So I think the idea of I love that idea of having a click through
I think they're kind of two things there, though. One is to like have a place where people can go where it makes more sense than just a list of numbers with a name of the nonprofit next to it.
Right.
That's the one side. And I think the Alliance has started to do that, right? Or maybe we would want to make one that looked a little bit more user friendly or whatever. But then there's that other thing that you keep talking about, which is that you can tell everybody if you need help, go to this website over and over, and you're still going to have all these people say, oh, I didn't know about that. And so I like that in one of our meetings, we talked about having something that's up in various places around town so that you notice it when you need it. Because human nature and when we're busy, you're not going to remember things that you don't need at the time. And so then when you need it, if there's a little QR code or a little something at the grocery store, at the library, at, at some various places, then you catch people who are like, oh my God, I actually need that right now. Right. So it's kind of two things, because we can make the most beautiful, easy to use website that populates exactly the number you need to call. But if people don't remember the website when they need it, because when they heard about it, they didn't need it, then it doesn't matter, right?
No, I think that's a good point, Jen.
Yeah.
Yeah. I think we all agree, Jen. Even if you try to go through the town's own website and navigate through that, good luck sometimes, right?
Yeah, and you have to be really comfortable, right? And know that it's there if I just keep looking. But when you're more like, I need help, what do I do? You're not going to keep digging like that. You're just going to feel like there's nothing there.
Yeah. One of the other big learnings from the survey was the difference in results for different demographics. And that's something we've talked about a lot. Russ, you and Jim have been always talking about getting to seniors is just different. The mindset is different and all of that. And I think flagging that as priority of having the groups who are expert in those different demographics probably being part of the program to translate, you know what I mean, to the different demographics. As an example, the mom's piece was really serious. The parents of teenagers, they were the most stressed of everybody. Now, New Canaan moms, the process, they're perfect for that. But even using them as a vehicle with even in a more informed way, because there's a lot of opinion that can fly around on those things, like, oh, this is what you should do, as opposed to, oh no, call these guys. And I think flagging the segmentation piece as part of this awareness is, I think, something we might want to build in, because that was definitely a learning from the survey. And by the way, I think you guys have all seen the movement, at least on the Silver Hill numbers of seniors, has gone up, which I think is a good sign. But it seems like this awareness thing is, and what to do is still a great concern to everybody on the call here.
When they looked at the survey results, I can't remember, were they saying our awareness numbers were lower than average? Or is this actually like on par with where most towns are?
Is that awareness of resources or awareness of issues?
Awareness of resources.
Resources. Okay.
And correct me if I'm wrong, Peter, what I remember, Raquel, is that for similar towns of socioeconomic status, whatever you want to put that, we were right in line with what everyone else was, or in the ballpark of where everyone else was.
You just
And
don't like the number, which I think.
Yeah, that's what I remember. That, we're not dissimilar
Yeah.
based on our median income and that type of thing. That's what I remember in terms of Bernardine. But I also I remember that our completion percentage was high relative to some other towns, which was also a good sign. But at the end of the day, it's like, and I use the example for the men's club, right? The men's club, if you want to survey the active men who are not isolated, who not need help, who know where to get fun. Then you go to the men's club and everybody goes, we're great, we're fine, we know where everything is. So if you survey them, life is good and everything's wonderful. As compared to maybe the people that get Meals on Wheels every single day. They're going to have a much different perspective on what resources are available to them.
Yeah. Yeah. And I think from a commission perspective, we can provide that guidance that solutions for the different segments is something that we would very much promote. Talking to the Alliance and all the other sort of folks out there, because that's, I think it's important notion to get to everybody to move those numbers up where we can.
Sure.
Anything else jump out? And again, this is just the beginning. One thing I'd throw out on the health side is being aware and tracking changes at the federal and state level on guidance and protocols and stuff like that. I mean, I don't know, maybe this is an emerging issue, but the possibilities of confusion and changes, and not to mention budget issues. And I don't know where exactly how to bucket that, but it's something that certainly, I certainly hope that Health and Human Services and both areas are aware of that and starting to think ahead a little bit from a dollars perspective. And Russ, you're super close on all of this, but it seems that that's got to show up somewhere. I'm not sure if that's in bucket 1 or bucket 2 as emerging, but it's a real thing.
Well, the number of people that will be coming off of Medicaid will be significant, and it probably will not hit our zip code as hard as our surrounding zip codes. But when you look at our affordable housing, I think it's going to impact them pretty heavily in terms of whether they're insurable through their company, or whether or not they relied on Medicaid, or they were dually eligible under a Medicare, Medicaid scenario, and now they're not, right? So, and that's going to have an impact on the emergency departments and charity care and uncompensated care for sure for healthcare providers. But you could literally write an article every 4 hours on the changes that are being proposed and coming down from Medicaid and the state. The state budget's not even finalized, and I get 4 emails every minute on the state, and what's going on. The federal government's even worse. With the cuts in home care, as an example, for those individuals who are homebound, you're going to see a 6% reduction. You're going to see home care agencies closing their doors. That's real. That's impactful to me. And I think it goes back to, I think we were going before, is for those people who are isolated, whether it's children or whether it's a senior population, that to me is a pool of souls that we need to learn how to communicate with, and to make them feel comfortable accessing services and programs, because we are blessed in a town that has so many great nonprofit providers that reach out to people. And Barb, you'll even remember the people, during COVID, people said, stop calling me. And you may be my only friend, but I'm not expecting you to call me, 3 times a week,
Right, the older people, they were like, I'm
Right.
fine, really fine, yeah. I remember
Yeah.
the church called me, and the Y
Yeah.
called me, and
You're the only call I get, but 3 times a week's too many.
Yeah.
That's a good problem.
Exactly. At least it wasn't telemarketing, right?
So I'm just thinking about, I'm just thinking about transferring from, because I feel like we're all on the same page and we're all in an agreement
think so.
So how do we transition next into like, what are the action items? Like Russ, I hear what you're saying, but I don't even know how we would wrap our arms around that in terms of taking actual action. You know what I mean?
I do.
Which I'd be happy to do if someone had ideas. I'm not saying, oh, we're not going to do that. I'm just saying, I don't even know where we would start.
Yeah.
Like, what are we thinking in terms of, where we start? It seems like we're really focused on the communication piece. And I think that makes sense because it's, not way outside the realm of what traditionally the commission has done. And it's something that the survey definitely pointed to as having holes, right? So it makes sense to focus on that, the communication.
Yeah.
Excellent point.
I mean, listen, I think we start with identifying the big issues and
Mhm.
priorities that we have, boil them down, and then to the extent we're hearing about ideas that other people are doing, we can sort of break into that. But I think we're trying to do forest for the trees.
Yeah.
And the reality is we don't have the resource to do
Yeah.
much of anything other than to support and provide this kind of beacon, even for town government, where they can go, oh yeah, that area, we know that that's a priority.
Right.
Um, is how I'd frame it.
Would it make sense to try and get a list of all the resources? I mean, you see them all over the place. Would it make sense to try and just go to all these, different websites and try and put our own list together? I mean, obviously Marcy has a list, which is posted on the website, but maybe it could be updated.
Did anyone see the latest version of the Sentinel paper that came out? If you do get a chance, go look online. The paper tried to do that.
Okay.
The paper tried to, in a color-coded way, took a half page and said, here are all the services in town. Problem when you read through that, it looked like it was about 12 years old. There were things in there that are no longer there. Programs not listed in the right corners. Like Silver Hill was on the educational section. It wasn't even in the mental health, behavioral health section.
They're
of-
not the most detailed on their fact checking and fact finding. Not sure they have an editor.
I think AI is one of their writers also.
Oh,
But
Anyway.
I'm just saying there's a prime example where they tried, but it wasn't. I mean, you do
not
don't
hard.
take my opinion. Go look at a half page ad of
Yeah.
what I considered, misinformation for a lot of people. So, but I don't know. I use that as just an example of someone that tried, but failed poorly on.
Not hard enough. Yeah. And Peter and I talked the other day about like, it is interesting in our town. I feel like there are very specific places people get all of their information, at least locally. And that would be, the New Canaanite, the library, New Canaan Moms. I feel like young parents often get a lot of information from New Canaan Cares in terms of like, here's the latest thought on helping your kids through these developmental stages or whatever. But I feel like it's not a long list. There's some core places where people get information regularly. And if we identify those, once we do have something we want to be communicating, to partner with those organizations could help a lot in terms of disseminating. Waveney would be another place, right? Where different people at different points, but tend to get information from these places,
I don't want to go off track. I think it's a great point you're making, Jen. It's limited, but we have a 24/7, 365 navigator program right now, but it's only limited for if you're a caregiver or for Alzheimer's and dementia, right? And it is an icon that's on your phone. So if you're under stress or anything of that nature, you just push the button and a social worker or a nurse will answer the phone and walk you through that.
How expensive is it to do something like that?
Well, we pay that. One of the thing is that people in healthcare are used to being on call.
Right.
So if you rotate call, it's not, you're not paying dollar for dollar for someone to be on call.
It's not an extra employee. Yeah.
Exactly. So that is part of their compensation, that they are on call. They rotate call like any physician would rotate call. I'm not expecting that, it's going to light up like a 911 Christmas tree, but when someone needs help on the weekends or something, that it rolled over to someone who's on call, and we just have to, if we were peel back the onion and make it actually an operational program,
Mm.
you would have to have, they need flip charts and know, okay, you have this, let me talk to you about that. They would have to be very well informed and educated on all of the programs that are there and available to you, and get somebody on the phone and wait and stay on the phone until that person picks up, right? You never want to just hit transfer and it goes to an answering machine.
Yeah.
And do you do that through a service? Is that like someone you subscribe to, or how does that even?
It is free. It is free of charge for anyone in New Canaan.
But I mean, from your end, how did you get it, connected up for these people?
We marketed the heck out of it. We
Yeah.
did seminars on it, and we developed the app for both all of the operating systems, so that you can download the app onto your phone, and you just press the app when you're in crisis and you need help. So
I guess that's what I'm asking from that end. Like, I
Yeah.
mean, how cool would that be if we had something like that, that parents, people, anyone in crisis more, on this human services side of things could just hit this. But like, what does that look like to develop an app like that? Or like, do you partner with somebody who already has people on call so you're not, hiring someone
Yeah, we
24/7?
spent the money already on, so doing it is not that expensive to do. So Waveney would be willing to sponsor that, and then you would just have to determine where the call goes to, or what's the call tree, if you
Yeah,
will.
kind of make the connections to the service.
Exactly.
Right.
Exactly. And the person that's on call picks up. And it's not like a physician where you have a service and you're saying, okay, you're calling Dr. So and so. The person that's picking up has to be well versed
Mhm.
and all the programs and services in town. And here's the number. I'm going to try to transfer you and get someone on the phone for you. In case I don't, here's the phone number, and we handle it that way.
Yeah. Super interesting and robust discussion. I'm wondering though if we should move toward just a quick overview on some of the emerging issues that we're all sort of sensing out there, because one of the things that's important about this, I think, is that the two departments that we're involved with are so busy solving issues, they don't quite have that same field of vision or the time
Mhm.
to be surveying and picking up things that are starting to get a little bit more of concern. And I do think this could be a very important service that we could provide, is boiling the ocean from our experience and coming up with what the four things that we think are becoming that should be on their radar. And I think that because First Selectman is incredibly busy, but if we can flag those things well, so maybe we just do a little quick round robin on that, and then we can, that one we'll definitely come back to, because there are a lot of things out there. But what's on people's minds of things that are growing quickly or of concern that are a little tiny bit below the broader radar?
Hmm.
If I could chime in on just one thing that I think probably combines this core plus emerging issues, as we have our new health director starting as well, making sure we're getting reports of like trends over time. Because that dropped off a little bit just in the transition, and I don't think we can keep a pulse on anything potentially emerging if we're not getting like trends. And so I always thought that that was really helpful that we had that. So just as a as a piece of emphasis from
Hmm.
like an oversight perspective. But to your question, Peter, I would say probably the thing that's on my mind, and it's funny because it's actually like just also like how do we use for good, thinking about the communications, but AI I think is a really big piece that's actually going to impact mental health potentially in a lot of ways in town, and just education and development of our young people. um how we do anything about that, I'm not sure. we do a little bit with Unplugged on just education side, but um, but I think that potentially gets sticky depending on how it's used.
Yeah.
And so it would be something for us to just try to get a sense of whether it's,
There you go. You're back.
all right, just, whether it's communication with the school board or whatever it might be, just, more coming from that perspective of, from a health,
Yeah.
what's the impact on
Yeah.
people from a health perspective.
Hell, could you give an example of what that might be? Like,
Yeah, so from a, one, from a positive use case, potentially, like, how do you navigate to where you need to go to find health resources, right? But also from a negative piece of, I'm gonna chat through AI to try to navigate on my own through a health crisis, and depending on what's feeding that learning system, right, you're gonna end up with different responses that are either encouraging bad behavior or not. And so it's a little bit of really the education piece of when that's a safe route versus not.
Yeah. I mean, I can give you a bunch, but I'll just highlight two. For one thing, job security and financial security could be really affected by this
Yeah.
over time. Jobs going away, investment accounting, legal. I mean, AI honestly is the biggest issue of our time, and nobody's really talking about it at the national level. Another example for kids, the learning that won't be happening as they delegate more and more of their brains to AI, big parts of their brains are not going to be developed. I mean, there's a lot of data around like spatial awareness. Somehow the professions that are most resistant to dementia are like limo drivers, cab drivers, and like the London cabbies and stuff. And now that skill that we all historically had about spatialness is gone. And that's a huge brain loss in terms of skills and capabilities. So it's immense, and it is going to come on to us way faster than everybody believes across multiple areas. I had it on my little list, but I thought, oh my God, am I being a little too airy-fairy here? But it's
Well, and it's so big. It's just so
Yes.
hard and so unknown. It's really hard to
yeah,
put into words like how to prepare for it.
it is. It is.
It's going to be very transformative for sure. I mean, as transformative as Google was to look up, I've got a skin rash, and here I'm getting my diagnosis for a skin rash, to now taking this to another level where children are not getting that developmental ability to rationalize, to analyze, to experience,
Yeah.
where everything is instantaneous to them, without their own rigor in analyzing and making their own decisions. And that is, yeah, that is a huge wave that is coming, and we're already starting to see some wealthy people in our community starting to lose their jobs because things like algorithms are doing their jobs for them when it comes to investing, and AI is now going in and running clinical analytical stuff. So it's I have friends that are losing their jobs currently
Yeah.
over some of this. So
Yeah, and I think we could really perform a service, kind of Barb, the question you asked, to just list this sort of stuff out and have some bullet points, because it really will shape the way people are looking at headlines and our leaders look at headlines. But this is the kind of,
well, and that's why I think Raquel's idea too is like a form you can trust. It's not AI, it's written by us, and it
right.
has the right information. It's not going
Yeah.
to misguide you. Sorry, I think I interrupted you.
Yeah.
You know, Raquel and I put us, and I'm sorry, Raquel, but we're very data driven. I think both of us are. And we have not, as long as I've sat on in the commission, it's been quite some time now, we've not seen any data that's come from the school nurses. At least I've not seen any data that has come from the school nurses. Waveney runs the school nursing program for Wilton, and all of the school nurses in Wilton are employees of Waveney.
Hmm.
We have to
Didn't know
produce
that.
we have to produce weekly reports to everyone, and not with people's names on it, but we have to say how many asthma attacks occurred this week, how many neurotic or acting out occurred this week. We have to produce all of that data to look at, oh my gosh, we're seeing trends in elementary school, we're seeing trends in the junior high program, um, battered spouses, how, kids coming in and we're finding out that, mom was in the hospital in the emergency room, and so they're having a little bit of a meltdown. All of that data we have to produce. We're not insular in keeping that data. And here we are as a Health and Human Service. And I would say this if Brian's a friend of mine, I would say this if Brian was on the phone. I've never seen, as a commissioner for Health and Human Services, I've never seen a report or a quarterly report or a monthly report come from our school nurses saying, here are some issues and trends that we're seeing.
I haven't either, but it's interesting to me. So the Wilton nurses are run by Waveney. Who runs our school nurse program? Is it all in-house?
It is all in-house. Yeah, it's run by the
So I guess my first question would be, does Brian receive those reports?
I don't know.
I
There's-
would think that they need to be reporting, and I would hate to like ask them to do something extra. It would just be great if they could also send that information through, you know? But I think Brian might be the first person to ask, because I know he really likes to keep things in-house to keep it efficient. But I would have to think that the state has
Yeah.
mandates, like you've got to report stuff to us, to the state health department, right? Or
Yeah,
not? I don't know.
of course.
Yeah.
But that would be real. I agree. Like that, now that you mention it, I can't believe we haven't really thought or talked about that. Like that's a huge way to see trends starting, at least among, our school age population.
Yeah.
Well, and to your point, Russ, it gives us insight to what's happening with the adults too. I
Yeah.
mean,
Yeah.
they are a reflection of what's going on at home.
100%.
There's still lots of work happening, edging forward on the youth survey to map the adult survey that we just did, and that's inching along from everything I hear, with progress. And I think we let that happen because it's delicate. But I think that data hole, Russ, you've always mentioned it, is a serious one. This is a little beyond our pay grade because it gets to organizational issues and history and cultures and stuff like that. But it's a real thing, especially given how big a source of anxiety kids' health are. Is there anything in the addiction world, like youth gambling is something that I always keep hearing about from my daughters, and all the boys are doing it, and
Yep.
potency of marijuana. I know that's a big Dr. Gerber issue about how relaxed parents are, and he's going, careful, this is not your father's weed.
It's not what you got in Washington Square Park in the 80s.
Yeah.
Oh, personal revelation there.
No, I had nothing to do with New York City growing up.
No, but I think just the addiction area, that's one to, boil our little ocean, like what might be emerging in those areas, and even, psychiatric ailments or stuff like that, things that we're starting to see. And, this is where Silver Hill is brilliant about, it's like one phone call with Dr. Gerber and he can go, okay, this is the new thing. that we're worried about and we're tracking. I just think we should have a view on that and alerting them. I mean, I think the AI, I think, is super powerful, but all the other areas, what are the things that are emerging that probably haven't hit their screen yet? That it's our judgment that they should really keep their eye on. And so maybe we can kind of leave it there, but I think that we'll have more ideas and we'll have other ways to move this piece forward. I want to get to the last piece, which is near and dear to a lot of people's hearts here, which is in the prevention and upstream and root cause kind of stuff about, where do a lot of these problems kind of begin and can they be addressed in some ways more from a training, skill building, resiliency, ideas of belonging, these kinds of areas, which kind of will ultimately manifest in more serious issues. And this is something I think we are also uniquely in a good position to weigh in on because, we don't have to fight the daily fights all the time. We can think a little bit more deeply, like we do already as a commission with some specific notions and ideas. Of course, connectivity has been one that we've emphasized before, but this is that final bucket, which will be about, healthy lives and fulfilling lives and have people reaching their potential. What are the things on the positive side versus the more negative intervention side that we can also be emphasizing that we think are going to be very powerful. And Raquel, you're incredibly passionate about this, but I'll just maybe lob it to you for a second, but I'd love to get everybody's take on that because this could be a very rich area and kind of a unique voice in our whole sort of ecosystem because the ecosystem is still very focused on high acuity. You got a real problem, who do you call and all that. And, we're quietly, and the school system, social and emotional learning, they're tapping into this in sort of a light way. But what does the group think about how this final bucket might look? And Raquel, why don't we start with you, and then we'll go around the table in our few minutes we have left.
I think the main point I would probably make on this is trying to understand that thriving piece and just take the opposite side of the data from the survey, right? Like the people who are doing well, is there anything that makes them stand out? And I think we've lightly asked the question before, but a more pointed question of, is there anything in the data that guides us towards, a thing that we could create that's like ways to thrive in New Canaan, but that idea of like, whether it's, are you connected to a community group or, and be really nice to say, are you connected to a community group? Our data shows if you're involved in 3 or 4 community groups, you really start to feel like you belong. Where can you plug in? Something like that. I don't know, and just an idea, but again, trying to understand that a little bit more, I think would be an interesting place to start from, just to Russ's point, having a data-driven answer to prevention.
Mhm. I love all of that.
Yeah.
I wonder if we can look at the survey results and try and find, I know you asked that question before, Raquel. I'm just still thinking there might be something there in terms of.
Yeah, I remember I think we all were a little disappointed that you didn't see a big delta between people who were involved in a bunch of groups and people who weren't.
Right, that was what I remember. Yeah.
In the overall satisfaction and happiness. And, there's a question of how the questions are asked and things like that. But there's so much deeper stuff that has been done elsewhere around loneliness being as dangerous as smoking, 2 packs of cigarettes a day or something like that. There's a lot out there in these areas, which, again, we don't want to be preachy or anything, but I think we need to thoughtfully pick our spots on this one in a way that I think is consistent with how New Canaan perceives itself, which is a great place to live and a real deep community. but there are cracks in that. I mean, the isolated parts, and I love the way, these are across a bunch of different demographics. It's not just the hoarders, it's everywhere. It's the kids who just don't get out, but I think there's a lot of passion, and I think this group can, if we really put some wood against this, to have it be tight with some real insights and recommendations that'll be consumable by a broader group, because it's such a huge sprawling topic. But I think we could provide a great service by making these themes digestible, and highlighting the things that we think are important. Russ, what's your take? You've seen it from the different angles. You're obviously deep in this sort of senior area, but how do you think we should think about this bucket, and from your
Look,
perspective?
I'm going to look at two spectrums real quick. One is that we have a nursing school, which most of you know. Resiliency training is critically important for young adults, and maybe it's even more important for children. So we have Silver Hill actually come and present resiliency training to people. Raquel talked about putting a positive spin on things. Everyone has problems. Everyone has to deal with stressors. Everyone has daycare, housing issues, food, issues if you're in school. And so we very much wanted to focus our employees on resiliency training and how to handle that, and how to coping mechanism, and also working collaboratively coming out of your shell. As a grandfather of two little boys and a father of 5, we were lucky that our school system was built into the health system of our town. And so we were getting actual reports as parents, so that we say, oh, look, I'm using asthma as an example, but we're starting to see asthma going up, or children not being immunized. That's going up. We see it early on because if a kid starts acting up when they're 4 or 5 years old, there may be other issues that we need to address, and we need to guide the family to available resources compared to waiting until it's a more significant problem. So those are the type of upstream things that I think we can do. I will tell you, Peter, if you grabbed all of the cell phones of all of their high school kids, DraftKings or whatever, as a betting format on football games and basketball games, I would tell you it's probably on at 90% of people's phones. I will also tell you that we're seeing in Wilton a lot of different devices used for vaping now. Things that looks like USB that they sneak into class. They are self-medicating. Those are the things that we're seeing that are red flags that are going up. But you got to get back to being able to identify it, and without, having someone's blood work or an MRI, sometimes it's hard to diagnose these problems. And as much data as we can get and collaborate in a meaningful way, I think we can go upstream pretty far.
Yeah. Jen, you have any thoughts on this? Or this is great stuff so far on this, and I wish we had
Fiction stuff.
just any around the
Yeah.
root cause stuff. Yeah.
No, I love all of this, and I think that this is actually where the data starts to get really interesting for me. I feel like looking at data really helps with the seeing things upstream, or seeing things that you don't even realize are percolating. And then I think that the next thing is communicating to parents, because I am the mom of 2 teenage boys, and it blows my mind that people don't know that they're all gambling, and some of them pretty heavily. And I think often, like, thank God neither of my boys have that particular addiction streak, because it would have come up out of nowhere for me and just sort of been there. So the kind of communicating without getting away from the focusing on thriving, and without being preachy, and without trying to scare people, you're always trying to balance that. But sometimes I want to sometimes it feels like you need to scare people, a
Yeah.
little. But it never is an effective way to communicate or get people help. So those are my thoughts. I love the idea of getting more data on
Yeah.
trends.
And I think there's an opportunity, right? As they do put out the youth survey, I know we're not necessarily going to have a lot of impact or say on what gets asked, but I do think it would be powerful for us to have a statement that says,
Yeah.
as this is developed,
Mhm.
we highly recommend that you create questions that allow us to understand which kids are thriving, not just the problems. We don't, we need to know those, and how you get at that. And obviously, is the orientation of how you ask kids questions is very different. But that idea of the kids who do consider themselves thriving, it would be nice to be able to identify.
Yeah.
They don't gamble. They're not on social media. They're not,
Or
or
they have this level of activity that keeps them off their phone naturally, or
right, right. And so those are assumptions that we're making based on other data, right? That would be the impact, but we need to know what's going on here in New Canaan. And so I think that could be a place where we could have a powerful impact. And, obviously they're going to decide whether or not they do that. But to be able to say, this is important for us, I think is
Yeah.
the thing.
Great. Listen, why don't we leave it there? But God, great work, everybody. I think thank you for putting some time on this stuff. I think it's really important. We know kind of a couple months' time we'll have to have a document for the broader commission. I'll try to work with each of you to figure out efficient sort of work streams and maybe parsing things out a little bit, and maybe we'll have a meeting, as we get closer to wrap things up and sort of decide. But let me work on the next steps piece of all this. But this is a great foundation. And now it's kind of refining and filling in blanks and all of that sort of stuff. So I'll circle back with all of you probably and figure out how to efficiently move it all forward. But great work, great insight, and I love the seriousness and intensity with which this group approaches this really important stuff. So, well done, everybody.
Agreed. Wonderful, wonderful ideas. I'm glad I could be a part of it. And I have like 14 pages of notes. So there's a lot to do to move forward. But anyway, thank you for doing this. I appreciate you all taking the time.
Thanks, everybody.
Have a great rest of your day, everybody.
Thanks, everyone.
thanks.
Happy 4th to everybody too.
Happy 4th.